Jai Sri Krishna Chaitanya Prabhu Nityananda Sri Advaita Gadadhar Sri Vasari Sri Gaura Hare Krishna 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 Hare 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 Ram 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 Hare Hare. Okay, so uh, identify the structure from 1 to 8. Uh, 1 biceps femoris, 2 semi-membranous, 3 semi-tendon, 2 semi-membranous, 3 semi-tendinous, 4 medial head of gastrocnemius, 5 lateral head of gastrocnemius, uh, 6 common peroneal nerve, 7 tibial nerve, 8 popliteal artery, 8 popliteal artery, 7 tibial nerve, popliteal artery. Structure in the popliteal fossa. Popliteal fossa we have common peroneal nerve. We have common peroneal nerve. We have common peroneal nerve structure.
Recording in progress.
Okay, we have common peroneal nerve. Common peroneal nerve, tibial nerve, posterior uterine nerve of thigh, and genicular branch of the operator nerve, popliteal artery, and popliteal vein. Popliteal artery, popliteal vein. Popliteal artery, popliteal vein, small cavernous vein, and lymph nodes. Okay. Okay. This one done. Then the exam picture. This is posterior tibial artery, tibial nerve, posterior tibial artery, and tibial nerve. In the second picture, identify number 13. Number 13 is posterior tibial artery. 16 is posterior tibial nerve. Sciatic nerve. A is sciatic nerve. A sciatic nerve. B gluteus medius. A sciatic nerve. B gluteus medius. Tensor fasciolator. D abductor magnus. E long head of the biceps femoris. Gracilis. F gracilis. Uh, F gracilis. If gracilis, then if gracilis, G semitendinosus, H semimembranosus. Semitendinosus and membranosus. Yes, this is important. This picture. Seven piriformis nerve-related sciatic nerve. Eight superior gemellus, eight superior gemellus, nine inferior gemellus, eight superior gemellus, nine obturator internus, nine obturator internus, 10 inferior gemellus, 11 quadratus femoris, 12 gluteus maximus, 12 is gluteus maximus, and this side gracilis, abductor, gracilis, then abductor longus, this is semi-membranosus, semi-tendinosus, biceps femoris, tensor fascia lata. Hmm. Structure in the popliteal fossa. I've seen this one. Structure risk factor. Which structure is at risk in the which one is at risk in the supracondylar fracture of the femur? This is a popliteal artery. Popliteal artery causes of the swelling in the popliteal fossa. Causes of the swelling in the popliteal fossa. Okay, this is. From the joint capsule from the joint bracket cyst from the artery popliteal artery embolism from the vein popliteal vein varicosity from the skin lymphoma from the nerve schwannoma from the lymph node lymphadenopathy lymph node from sarcoma from the bone drainage of the popliteal lymph node. They drain lymph from the they drain lymph from the superficial lymphatic vessel, which they drain lymph from the superficial lymphatic vessel, which is accompanied from the leg and the foot, from the deep area of the leg and the foot, small Schaffner's vein, and from the deep area of the small Schaffner's vein, and from the deep area small Schaffner's vein, and small Schaffner's vein, and from the deep area of the small Schaffner's vein, from the deep area of um, and deep area of the leg and the foot. Rarely, they also drain the ovarian skin, and then they drain into the superficial and deep inguinal lymph node. This one identify vastus lateralis at 28, vastus lateralis 28, iliotibial tract 26, always, I don't know why I make mistake always. Vastus lateralis 28, and 12 is iliotibial tract, 12 tract. This is a tract nearby. This is a tract, iliotibial tract 12, and 26 is 26 is tensor fascia lata 26 26 listening. Okay. Uh, okay. Vastus lateralis 28, tensor fascia lata 26, and iliotibial tract 12, rectus femoris 17, sartorius 19, femoral artery, okay, femoral 6, femoral triangle, medially ligament, laterally femoral vein, anteriorly is inguinal ligament, posteriorly pectineal ligament. Structure of the femoral artery and femoral artery with femoral branch of the genitofemoral nerve, and femoral vein and deep inguinal lymph node. Action of the rectus femoris in the front, quadriceps groups. Okay, so they causes hip flexion and knee extension. Mhm. Action of the hamstring again in the back. So hamstring causes flexion of the leg at the knee and extension of the hip, thigh at the hip. Biceps femoris, lateral rotation of the hip, and simultaneous medial rotation of the hip. Okay, What are the muscle attached to the iliotibial tract? Tract is like tract 12. Tract 12. It is gluteus maximus, tensor fasciolata. Function of the iliotibial tract. They cause gives stabilization of the knee joint in the extension and partial flexion. Extension and the partial flexion. What is the name of the fascial compartment medial to the femoral vein? This is a femoral femoral canal. What are the two compartment? What are the old component of the compartment? Non-vascular component of the femoral sheath. Femoral sheath, we have lymphatic vessel and lymph node. Lymphatic vessel, lymph node, femoral branch of the genitofemoral nerve, and lymphatic vessel, lymph node, lymphatic vessel, lymph node, lymphatic vessel, lymph node, and femoral branch of the genitofemoral nerve. In picture below, and in case of injury of the common peroneal, in case of the injury of the common peroneal, which will be affected anterolateral aspect and the dorsum of the foot and the lateral of the leg. Then, if the patient is having loss of the sensation and anterolateral aspect of the ankle, unable to extend, then it will happen. L5, boundary of the femoral triangle. Femoral triangle, superiorly inguinal ligament, superiorly ligament, laterally sartorius, and medially erector longus, and flowed by ESS, peculius, and erector longus, and roof is by fasciolata, tensor fasciolata, superficial fascia, superficial fascia, fasciolata, superficial inguinal lymph node, and long Stephanus vein. Long Stephanus vein. Common peroneal nerve, structure number two. Common peroneal nerve, structure number two. If this is injured, anterolateral aspect of the left, sensory loss of the dorsum of the foot, sensory loss of the anterolateral aspect of the leg, biceps femoris, structure number one, nerve supply by tibial nerve, function lateral rotation of the hip and the knee, flexion of the leg of the knee joint and extension of the thigh at the hip joint, hamstring muscle, other hamstring muscle identified gastrocnemius, medial head 4, lateral head 3, innervation tibial nerve, Schiwan's nerve injury, great Schiwan's vein, harvesting for Schiwan's nerve, how injured, great Schiwan's vein harvesting for coronary artery bypass grafting and fasciotomy. One is great Schiwan's vein harvesting for CABG and fasciotomy. Mechanism of fracture of fifth metatarsal by avulsion, torsion, dancer's foot, and march past for the soldier. This is anterior medial view, anterior anterior medial right. This is anterior lateral. Hmm. With the talus and these bones, which joint will be formed? With the talus and this joint, which ankle joint, talocalcaneal joint, pin type of synovial joint, plantar flexion, dorsiflexion, okay, plantar flexion, posterior gastrocnemius, palmaris, soleus, tibialis posterior, flexor hazus longus, flexor digitorum longus, and dorsiflexion, tibialis anterior, peroneus tarsus, extensor hazus longus, extensor digitorum longus. Demonstrate eversion and eversion. Eversion, Eversion, this is eversion and inversion. Eversion peroneus longus, peroneus brevis, and inversion tibialis anterior posterior with the extensor hallucis longus, extensor flexor hallucis longus. What at what joint these movements subtalar joint. It is a pentagonal synovial joint. Tibialis anterior in the medial cuneiform and the fast metatarsal, and tibialis posterior in the medial cuneiform and the navicular and peroneus longus, medial cuneiform, fast metatarsal, peroneus brevis, and tuberosity of the fifth metatarsal. What are the muscle inserted into the medial cuneiform? Medial cuneiform, tibialis anterior, tibialis posterior, and peroneus peroneus longus. Peroneus longus. Anterior compartment. What is the compartment? Deep peroneal nerve, lateral compartment, superficial peroneal nerve, and posterior compartment. Posterior compartment, superficial bitibial nerve, deep compartment also tibial nerve. Dermatome, medial malleolus L4, dorsum of the foot, medial malleolus L4, dorsum of the foot L5, and sole of the foot by S1. This is calcaneum, talus, navicular, medial three cuneiform, cuboid, and metatarsal. So in the medial longitudinal arch, medial longitudinal name the structure on the red color tuberosity of the base of the fifth metatarsal. What will happen in case of fracture at mid talus bone, avascular necrosis because of heat received blood supply from the distal. In case of injury of the extensor retinaculum, tibialis anterior, loss of plantar flexion tendon to Achilles, complication of avascular necrosis. Medial longitudinal, calcaneum talus, calcaneum talus, navicular, medial three cuneiform, and three metatarsal. Lateral longitudinal are calcaneum cuboid, lateral to metatarsal, and transverse arch cuboid three cuneiform, and base of the metatarsal. Okay, structure under the extensor retinaculum. Tibialis anterior, tibialis anterior, then extensor hallucis longus, extensor digitorum longus, anterior tibial vessel, anterior tibial nerve, tibial nerve, and anterior tibial artery, sustentaculum tali group for the flexor hallucis longus, flexor hallucis longus. Which component of the ankle joint, tibia fibula, and the talus, synovial joint, plantar flexion, dorsiflexion, medial cuneiform. At what muscle inserts into medial cuneiform, tibialis anterior, tibialis posterior, and ankle talus. At which joint ankle is more stable in the plantar in dorsiflexion, because talus is stabilized posterior anteriorly. Uh, Talus is stabilized because it is wider anteriorly. It is wider anteriorly and narrow posteriorly. Component of the subtalar joint, talus and calcaneal, inversion and eversion, mid tarsal joint, calcano, cuboid, and calcano, calcano cuboid, and telocalcano nucleus. Complication of the neck of the talus fracture, avascular necrosis demonstrate pulse of the foot, dorsal spadius pulse two metatarsal bone, posterior tibial pulse, 2 to 3 centimeter billion behind the medial malleus. Okay. Identify 27 metatarsal bone. Shaft of the metatarsal bone. Diaphysis of the fifth and diaphysis of the fifth metatarsal bone. Diaphysis of the fifth metatarsal bone. Base of the number two. Number two, base of the fifth metatarsal bone 31. Tuberosity of the fifth metatarsal bone 31. Peroneus brevis tendon of muscle attached to the calcaneus tender Achilles. Loss of plantar flexion. Gracilis semimembranosus. Sural nerve, tibial nerve, common peroneal nerve, and biceps femoris. Long head of the long long head of the long head of the lateral head of the gastrocnemius. Anterior tibiofibular ligament, anterior talofibular ligament, calcaneofibular ligament, peroneus brevis, inferior peroneal retinaculum, extensor retinaculum, extensor retinaculum, bipartite ligament, extensor retinaculum, bipartite ligament, extensor retinaculum, bipartite ligament, uh, talonavicular ligament. Extensor hallucis longus. This is extensor hallucis longus tibialis anterior just before tibialis posterior. Then extensor digitorum longus, just opposite. First, flexor hallucis longus tibialis anterior, just opposite tibialis posterior, and extensor flexor digitorum longus. Flexor digitorum longus, then tibial artery and vein, posterior tibial nerve, and flexor hallucis longus. Flexor hallucis longus, and then tender Achilles. Extensor hallucis longus and flexor hallucis longus. Again, tibialis posterior, flexor digitorum longus, tibialis, tibial artery and vein, posterior tibial nerve, flexor hallucis longus, Achilles tendon. This one down. Okay. Now this is extensor hallucis longus, tibialis anterior, extensor digitorum longus, and peroneus tarsus, extensor digitorum longus, extensor hallucis longus, tibialis anterior. So we have completed whole anatomy. Finish. Lower limb also finish. Outside it is early morning. We have less than 1 minute. So uh, we can take some rest now. And when we woke up, we'll start with pathology. Very rapid. Whole day we'll read pathology and pathology will finish. You can give alarm after 4 hours. After 4 hours, we'll start and hopefully we can finish 2 times. Once we'll finish all our file, also we'll finish Salam of file. Hmm.
Good night.
Good morning.
No, good night. Bye-bye.
Yeah. Hare Krishna, Hare Krishna, Krishna Krishna, Hare Hare. Om Hare Hare, Hare Hare. Hare Krishna, Hare Krishna, Krishna Krishna, Hare Rama, Rama Rama, Hare Hare. It is early morning in the outside. Let's see nicely. Okay. So